This is Poncho the iguana, and he's apparently suffered some injury of some sort to his tail recently. He's got some ischemic avascular necrosis going on there. This is pretty common in lizards with long tails. Sometimes they, in the process of using their tail as a whip, they'll injure it, or sometimes parasites can be responsible for this, or they'll get it caught in in a cage door or something like that, and this leads to loss of circulation in the end of the tail, and this is what'll happen. It'll start it'll get ischemic, which means loss of circulation, and the tissue will start dying. And so to mitigate infection here, I'm going to go ahead and amputate the end of his tail. And in some species like bearded dragons, the tail does not grow back, so you have to perform a wedge resection, amputation, and then suture it up to give it a nice appearance, because that's not going to grow back out again. And I've actually performed one of those procedures before. But on some lizards like iguanas, the tail will regenerate. It won't regenerate like it was previously in its original form. It'll fill back in with cartilage, not bone and scales. But this will reduce the chances that this tissue death here turns gangrenous, necrotic, in other words, and gets infected, and it progresses farther up the tail. So we're going to reduce the chances of that happening by amputating back up here to what's known viable tissue, and then that should grow back out, and he should be okay. And what I'm going to do here, I'm going to give him a ring block here of some Vivocaine, which is pretty similar to what you'd get at a dentist office for oral surgery and whatnot. And so that will deaden his pain, and we'll go ahead and take the end of that tail off. Okay. I don't have a camera stand with me at the moment, tripod, so I'm just going to go ahead and do it like this and hope you can see. And we gotta be sure to take the needle in below the scale. And this will deaden that area up. Of course, it's going to take a second to take effect. So he's resisting a little bit right here, but he's actually being a lot more cooperative than I expected him to be. Okay. That ought to do it. And we will give that just a minute or two to start to take effect. This is similar to lidocaine, but it's not as fast acting, although it lasts a whole lot longer than lidocaine will. And I don't know if you can see this here, but he's got a open wound here, a little bit of blood there. So, and this happened at some point in the last week. I'm not sure what he did to his tail. He might have gotten it caught in something, or you know, he does occasionally use it as a bullwhip and try to slap at you with it. So he may have slapped the inside of his. See that? Just like that. He could have slapped the inside of his terrarium with some force and did it some damage. Ideally, I would like to restrain him and everything, but I don't have an assistant right now. That's not going to be possible. I think he knows something's up. Probably go ahead and do is cover his head. That'll calm him down a little bit. Now his head's covered. And some may ask, you know, why you don't use general anesthesia for something like this. And of course, that would reduce his pain even more if he was out for it. But also, that's a really big risk for what is a relatively minor procedure. So there's always a risk given a general anesthetic to animal or person that they're going to stop breathing and you know, they're just not going to wake up. So that's a pretty big risk just for removing end of a tail, which can be accomplished with a local anesthetic. So that's why we're doing it this way. I'm going to give him a little more Vivocaine on there topically. That will help with the bleeding. And as you can see, when I was cutting there, he wasn't fighting with me. This is not the ideal surgical environment, of course, but this is where we happen to be based out of at the moment, unfortunately. And their tails have fracture planes. So pretty much what I'm going to try to do right now is just after I've pretty much scored it with the scalpel, is to see if it will just snap. There we go. Got healthy tissue here. And this is our stiff, as you can see. This is just stiff as a board, dead tail, and there's no good that can come from leaving that on. I'm going to clean this up, give him a little more anesthetic here in the tail, and dress that, and then we will allow that to granulate on its own without suturing it. and that'll start filling back in like any other lizard, like an anole. Their tail regenerates. That'll start to grow back in as cartilage before long.